Olson, and I'm one of the women's health specialists here at Freedom Physical Therapy. And I'm here today to talk about diastasis recti, which is a really common problem after women have had children. What that is, it's a split of the abdominal muscles right down the center. The linea alba becomes widened during the childbirthing process and even during pregnancy. And it really creates a lot of problems for the woman trying to return to activity and even just keep up with her family. So I'm going to teach you how to check for a diastasis recti at home. And this is Molly, and I'm going to be teaching her the same thing as well. So Molly, first thing we're going to do is you're lying down in a hook lying position with your knees bent comfortably. We're going to take your arms and place them out like this. And you're just going to lift your head up, okay, and hold that there. And now take two of your fingers and put them right in the center at your umbilicus. And what we're trying to see is how much distance there is between the two recti muscles, okay? So go ahead and do that for me. Okay, so two straight fingers pushing straight down to the umbilicus, okay? And she's having a hard time getting her two fingers between the umbilicus here. Good, so you can come down and rest. And that would be a negative test, so Molly does not have a diastasis. If she had a separation of the muscles 2 finger widths or greater, meaning she could feel the muscles on either side of her fingers, and she can sink down between them 2 finger widths or greater, that's positive for a diastasis. We really need to check this in multiple positions. So now that you know how to check for this, we're going to look not only at the umbilicus, but above and below. So let's go ahead and do that again. So you're going to lift your head up to the same distance. Go ahead and check above, okay? So she's pressing down. So we're about 1.5 inches to 2 inches above her umbilicus, and pressing down, and it's even harder for her to get that 1 finger in. So she's still negative up here. Good, and you can come on back down. And then when you're ready, we'll check right below, okay? So here she comes, she's pressing up, yep, and pressing straight down here. And once again, she's about 1 finger width between. So this finger up here is on top of the muscle, okay? And you can come on back down. So if you're having trouble finding that at home, what you can do is you can start by putting your fingers right between the muscle and then curl up. And you may have an easier time checking that way. So let's try that variation, Molly. So you can press your fingers right in between the musculature. Now lift up, and can you feel the muscles on either side here? Yep. Okay, and then you can come on back down. So it's going to feel like 2 ropes on either side of your finger, and we're trying to see the distance between those ropes. And if that distance is greater than 2 finger widths, then it's positive, and that means you have an abdominal wall separation. When you have an abdominal wall separation, it makes it really hard for you to do activities normally without putting your back, your hips, your pelvis in kind of a dysfunctional movement pattern, which can cause pain. So if you find that you are positive for that, you can reach out to one of our women's health physical therapists here at Freedom Physical Therapy, or check out our website at freedompt.com, and we can help you with that. There's certain exercises that we can do to help those muscles come back together. There's mobilizations with massage and soft tissue mobilization techniques that we can use to help provide a little bit more stability in the front to allow you to do what you want to do in your life without pain. Thank you.